is Dr. Frank Manase, alumni of the Johns Hopkins Bloomberg School of Public Health of Baltimore, United States of America, also an alumni of the University of Cape Town, UCT, South Africa, and also alumni of Muhimbili University of Dar es Salaam, Tanzania, East Africa. I'm also a founder of the health organization called Community Center for Preventive Medicine, CCP Medicine, which is based in Tanzania, East Africa, with the focus of protecting lives and alleviate sufferings for everybody. All of our interventions are purely community based. And why did we choose to have community based approach? It's because we thought and believe that diseases are produced at the community level, meaning at the household, and hence we believe proper and appropriate solutions should emanate from the community. And this is why all of our interventions are integrated and are tailored at the community where people live. We find our approach being very unique compared to many other approaches from the experience of implementing our interventions for the past 10 years. And three main lessons that we've learned include: number one, community-based interventions that we implement, we find them to be more effective and sustainable, in the sense that whether you have superior health outcomes, you tend to celebrate together with the community. And if you have poor or negative results, they are also owned by the community, and you share the negative experience in the community at the same time, feel as part of it and not disowning the results. And hence, improving becomes so easy as you are working together. Number two, the idea that you follow people where they live with the health interventions has a lot of benefits. Being one, you get a buy-in of the community, and you also have less resistance or uptake of whatever intervention that you are trying to instigate. And third, it gives you an opportunity to reach vulnerable groups, less to reach groups, for instance, children, people with disabilities, and older people. Number three, it is possible and feasible to implement the concept of primary health care. And in the sense that when you talk about primary prevention, whether it's non-communicable disease or communicable disease, where your aim is to reach people who do not have disease and you want to protect them from acquiring or develop disease, becomes so easy and possible. But also the concept of secondary prevention, whether it's non-communicable disease mostly, then these are the people with the early stage of disease, and you are trying to confine the disease condition not to progress into advanced stage, becomes very possible. But also tertiary prevention, where people already have a disease, maybe advanced disease, but you want them not to develop unwanted health outcome complications. For example, people with diabetes, you don't want them to lose their sight. You don't want them to get renal failure. People with hypertension, you don't want them to get stroke. So tertiary prevention is also possible when you have community-based intervention following the patients or the community where they live. How has it been possible to implement primary, secondary, and tertiary prevention strategies? We manage this through uh, behavior change. For instance, eating behavior, where our emphasis has been on eating fresh versus uh, or less processed food versus processed food with less salt, but also drinking of water versus high sugar content stuff. And third, emphasis of loving vegetables and fruit versus the natural behavior that vegetable and fruits, as common in our practice, is the food for sick people. And what sort of achievement we've ever received in the past 10 years of implementation of a community-based health promotion initiative? Number one, we have been able to conduct nearly 218 public health promotion activities. This including bringing the public together, screening for various risk factors, non-communicable disease, education, as well as linkage to other facilities where interventions can be undertaken earlier. Having done that, we were able to reach nearly 60,000 people of all age groups, including people who are vulnerable and harder to reach in the community, for instance, children, older people, and people with disabilities. We also have managed to conduct nearly 150 trainings for healthcare professionals, but also community healthcare providers, formal and informal. For instance, spiritual counselors, social workers, on various community-based health promotion initiatives. But most importantly, we have managed to organize a professional scientific conference in collaboration with higher learning institutions. So we have 5 universities: Kampala University, Muhimbili University, Kairuki University, as well as KCMC and Uganda University, where academic and lecturers, as well as students, have been engaged to participate in this activity, but also community representatives like spiritual counselors, social workers, community healthcare providers also are brought together in the same page, where we now start to learn on how to speak the same language, because we both take care of the same patient, but one at the facility and another one at the community or home based. Third, we also have managed to mobilize volunteers who are healthcare professionals, donating their time, uh, mainly from local, the ones who are spending most of their time at the health facility, but those who are outside the health sector as well have been able to join our initiative and being able to support achieving the achievement that we talk about today. And we were so happy because in the year of 218, or year 2018, we were privileged to have Dean Ellen Mackenzie, Dean of Johns Hopkins Schools of Public Health, who traveled all the way to Tanzania, and we were privileged to have her giving credit and accreditation to all volunteers who have been participating in our program in the past 10 years. We acknowledge and thank you for doing that. And lastly, we have managed to conduct simple research and managed to publish up to 10 uh, articles in high factor journals now accessible online. So, what is our focus in the next or the upcoming 5 years strategy? Is that one, we would like to consolidate what we've been doing so that we are able to share this experience within the country in the different geographical areas, but also involve or engage the global experts or the internationals, also learn from the experience we have. Number two, we would like to develop and establish our training component and being able to offer a certified training at the level of certificate, diploma, degree, and postgraduate in collaboration with higher learning institutions. So what is the purpose of this trip to the United States? One is to solicit funds And what we are looking for a commitment from the community, the way how we say the community. So we are looking for the support from the community. We are looking at them individual, families, congregations, group of students, church, and people, organizations. A commitment of $1 to $5 or more per month, and we're looking for to raise at least 15,000 USD per month, and this will be able to enhance our initiative consolidation, but also developing our training program optimally to reach our goal. And number two, we are looking for a stronger and strengthened collaboration between our initiative and Johns Hopkins Bloomberg School of Public Health, especially in developing our training research component of the program, so that to expedite our intention to be the Center for Excellence in Tanzania and Sub-Saharan Africa. So we look forward to your favorable responses and understanding and acceptance. It feels so privileged to receive your positive response and to invite you to be part of this special beginning of a big picture which we are looking for to save millions of lives at a time. Doesn't matter how far you are, but it is possible because we are connected through public health. And this is the power of public health, the power of the community that I ever invite, I ever honor as a lesson that I learned when I was a student, and I continue to be a student at Bloomberg School of Public Health. Thank you very much, and welcome to join us.